The Bowden Street Health Center in Dorchester recently expanded with a new wellness center. To talk about the addition are two guests from the health center, the Assistant Director, Philomene Baptiste, and the Program Manager for Wellness Programs, Jen French. Thank you both very much for being with us.
Thank you for having us.
I want to start with Philomene Baptiste. What is wellness and why is it so important to be done from a health center?
Right, so wellness is everything when you come to think of it. It's not just the physical health, but the social and other aspects of a person's life that helps them be well is a part of what encompasses wellness. I think that for Bowden Street, we want to make sure that we are providing holistic health, so to speak, to our patients, making sure that we have the right services, the right programs, and the other components that can benefit them in the long run in terms of having healthier outcomes.
Jen, when I hear wellness, I think of exercise, but take me a little bit deeper here. What goes on in this program?
Well, in our new expanded facility, we have everything from nutrition services to physical activity services to expanded behavioral health to trauma recovery and violence prevention support. We not only take care of our patients, but we really have the best interests of the wider community in mind. And something that's really exciting now with this addition is that we can offer these services on site in a very safe and trusted setting where most people in this neighborhood already receive primary care.
I know it's great to have more room. I guess, where were you doing it before?
We would do programming in our conference rooms. We would essentially have to outsource certain programs to community partners, which I think actually has worked out for the better that we've built such sustainable relationships with community partners over the past several years, because these are the folks that are now our star instructors in our wellness centers giving back to our patients on site.
What about how wellness can make a big difference in somebody's life? I was reading about one patient. She's elderly, and even I'm old enough to say, how much longer can I handle these stairs where I live?
Right,
so
right.
that's a big issue.
It is a big issue, and which is why we've, we are also not just working with the patients, but our staff has also started some wellness initiatives as well. Not some with the lead of Jen in the past, but other staff are taking initiative to do the same things that we, kind of advocate for our patients to do. So for us, it's really looking at all aspects of health and what can we draw from in terms of what the patient needs.
Jen, what is the difference? Because a lot of the times, people, they see a doctor and the doctor says, okay, change your diet, get some more exercise. But, a lot of the time, the exercise part especially, we don't follow up very well.
Well, I think one of our biggest goals with the Wellness Center is that we're now able to really integrate wellness programming with clinical care. So our providers are directly involved in prescribing exercise or cooking classes to patients. And since this is a team-based approach to care, we meet people where they're at. We hold these activities on site. Someone can come directly from a primary care visit to tour the Wellness Center space, see where the classes are taking place, meet the staff that are teaching the classes, and I think just feel comfortable right off the bat.
Philly, when I think of exercise, I think of being in gym in high school. It was grueling. You did it because you had to do it. But what's the atmosphere like at this?
The atmosphere is very welcoming. So like Jen just mentioned, it's people that you see throughout your visit, or people that you would see during your medical visit, you would actually see being either a part of the class or, in some cases, what we're about to do, even teaching the class with a new program that we have called Train for Change. So it is a very welcoming environment. We have great staff. Jessica Birch, who's our nutritionist, is really great with the kids. She has an extensive background in culinary arts and also, like I said before, she's a registered dietitian. And so she brings a sense of a level of comfort to our patients. And like Jen mentioned, meeting them where they're at. So an example of that would be, I want to say maybe 2 weeks ago, we had a cooking class, and it had 4 men in it. 4 men, and they're all of Cape Verdean descent, and they actually participated in the cooking class. And so for us, that was a huge accomplishment in order to engage them, have them participate, and really get something and take it away from the class.
Jen, why is knowing how to cook so important for your health?
Well, I think all of us could probably use a few tips on cooking. But I think that it's just back to basics. I think a lot of our population doesn't know the very basics, and just you'd be surprised at even what a small piece of education can provide. I work with a lot of youth in our pediatric obesity programs who think that fruit juices are healthy because they're made of fruit, and just have never had that education of, you know, how much sugar is in something, how to read a nutrition label, how to shop. So I think that now we are not only providing these services to people, but we're teaching them how to sustain these healthy behaviors on their own.
And of course, if you have to cut down salt in your diet, you have a much better chance if you're preparing the food at home, right?
Exactly. And one of the things that we have done with our multiple cooking classes that we've already held on site is to cook with the ingredients that the patients select the ingredients, and our nutritionist will cook with them and teach them all different ways on how to prepare them. So they taste good. It's not just healthy stuff. It tastes really good.
Well, you mentioned patients from Cape Verde, and I'm wondering, is this also about culturally appropriate health care that's really tuned into where people come from?
Absolutely. I think that's a huge part of it. So about 43% of our patient base is made up of people of Cape Verdean descent. And then from that, outside of that, we do have other Caribbean islanders, Spanish-speaking patients, and I think it's very important to make sure that we are in tune with people's cultural habits, so that in order to, get to behavioral change, we have to meet them where they're at. We have to be able to understand where they're coming from, understand certain cultural things or cultural perspectives that they come from in order for them to have healthier outcomes.
Jen, you ever hear about these outcomes, people saying they're either feeling better, or you see some numbers?
I do, and I'm fortunate enough to get to see firsthand, since I work so closely with all of our groups that come in for these services. Not only are we seeing changes such as weight loss, but people are excited about health. And I think that's something that wasn't really present, especially in this community before. We have a lot of history of violence and people not really wanting to engage in services like this. And now that we have this facility on site and we have such a close-knit relationship with our patients and with our larger community, people are excited and they want to come in and explore. And this is a safe space for them to do that and to essentially design for themselves what it means to be well.
Well, whether it's diet, exercise, or people struggling with trauma, what's the best way for them to get in touch?
So they can definitely call our main number, 617-754-0100, and they can start from there. They can either make a new patient appointment with their provider, and then, they can then be, referred to Jen for wellness activities, and we will just take it from there as long as they reach out to us.